At Abramson Facial Plastic Surgery and Rejuvenation Center, Dr. Peter Abramson performs transforming procedures daily. He's become one of Atlanta's premier rhinoplasty surgeons. We recently had a chance to talk to him in his state-of-the-art surgical center. Let's listen. We're with Dr. Peter Abramson right now of Abramson Facial Plastic Surgery and Rejuvenation Center, and we're so glad to have you with us, Dr. Abramson.
Well, thank you for inviting me.
Now, you're a facial plastic surgeon. You have a fascinating practice. What does your specialty consist of?
Well, as you mentioned, my training is in facial plastic and reconstructive surgery, so I focus only on the face. The procedures that I primarily focus on are facelift procedures, eyelid procedures such as eyelid lifts or eyebrow elevation, also ear reshaping, primarily for kids, as well as rhinoplasty and multiple other ancillary type procedures such as Botox and some of the filler materials such as Restylane, Juvederm, Evolence, and Sculptra, as well as Radiesse. These help to rejuvenate those areas of the face that have lost a little bit of their fullness, such as the lips or the cheeks. Well, I'd have to say out of all the procedures I do, my favorite is rhinoplasty. I just like the idea of being able to reshape the nose for patients that have many times thought about it for years and years and years, but haven't gotten to that final point where they wanted to go ahead with the procedure.
It was pretty easy for me to make the decision to have my rhinoplasty. I had thought about it for a long time, never really liked the bump in my nose, but when I found out from my ear, nose, and throat doctor that I had to have sinus surgery and internal nasal reconstruction, it was very easy for me to make the decision at that point to go ahead and have the outside done as well. Although I was really nervous to have surgery, as anyone would be, Dr. Abramson and his staff put me at ease. They gave me great preoperative advice and very specialized, individualized care throughout the whole process. And when all was said and done, it was a lot easier than I ever anticipated. I didn't have a lot of pain at all. And by the end I was really happy with my result. So happy, in fact, that I would recommend anyone I know or cared about if they needed anything done on their face to Dr. Abramson.
Well, when a patient comes into our practice, we always sit down and have a full consultation with them. That involves multiple things, including going over the past medical history, making sure they're a good patient medically to go ahead with procedure, as well as asking the patient, what is it that you're looking for? Then I do an examination, inside and out, and looking at the shape of the nose as well as the structures underneath. And then we sit down and have a long discussion of trying to coordinate what they would like to do with what I think would be the most appropriate, and then coming to a conclusion. Along with that, what's very helpful in our practice is the computer imaging system, which is a great communication tool. It's not necessarily a before and after, but it really helps us to get on the same wavelength and determine what's going to be best for that patient. Most patients want their nose to be, of course, different, reshaped, improved, but they don't want everybody else to notice for the most part. I even had a patient say, I want the anonymous nose. I want to know that it's been changed, but I want people to notice my eyes or my hair or other things rather than my nose. And I thought that was a great way of putting it.
Now, we have to talk about one extremely important benefit that you offer all your patients. That is the use of this beautiful surgical center you have within your practice.
Oh, we are very proud of our center here. It's a AAAHC outpatient surgical facility, and almost all of our rhinoplasties and facial plastic procedures can be performed here as an outpatient.
Dr. Abramson, what would you say to the person who's thought about having this surgery, nose reshaping surgery or rhinoplasty, but just hasn't taken that first step?
Well, the important thing for the patient to do is to come in and have a consultation with us. Many times we have patients who have thought about rhinoplasty for years, even decades, before they'll come in and sit down with us. It's important to know your options and know what's possible for you. We also have put together a website, which is an educational website for patients, called rhinoplasty.atlanta.com, that patients can also go to first, even before their consultation with us.
Thank you so much for your time today. This has been such interesting information for all of you who have been wanting to know more about rhinoplasty or nose reshaping surgery. Thank you, Dr. Peter Abramson, for being with us.